Hello, my name is Brooklyn Jones, and this is my integrative review presentation on improving childhood obesity in the pediatric population. According to the CDC, pediatric obesity is defined as having a body mass index at or above 95 percentile and overweight defined as being at or above the 85th percentile but below the 95th percentile. With obesity on a continual rise, we are going to focus on how implementing a combination of diet and exercise can result in a reduction in the pediatric obesity. When you look at the evidence, according to the CDC, 1 in 5 school-aged children are defined as obese. They also report that the rate of pediatric obesity has tripled since 1970. There are multiple local, state, and national level intervention programs to assist in the reduction of pediatric obesity. At the local level, there is a program called Change for Children in Rural America that was initiated in 2009 to assist elementary schools on how to properly implement healthy eating and exercise into daily life at school so that it can be carried into their homes. At the state level, there is a program called WIC, Women, Infant, and Children, that assists lower income families with purchasing healthy foods through provided funding with limitations on the type of foods that they are able to purchase. And at the national level, Healthy People 2020 reports that early childhood years are when children are at the highest risk of becoming obese and suggests implementing healthy food and daily exercise, hoping to reduce this epidemic. We're going to look at 2 research studies that focus on improving pediatric obesity. The first study was conducted in 2012, and it focused on how diet and exercise combined can reduce pediatric obesity as opposed to no lifestyle change. This is a randomized controlled study where they chose 110 overweight children, ages from 6 to 16, divided them into 3 groups. 45 were placed in a hospital clinic group, 41 were placed in a home-based group, and 24 were based in a control group while monitoring the participants' body mass indexes throughout the entire study. The participants in the hospital clinic and the home-based groups followed a designated Mediterranean diet and combination exercise program, while the control group had no change in their lifestyle. The results of this study showed that there was a reduction in body mass indexes of the hospital clinic and home-based groups with little to no change to the control group. The second study that we're going to look at was conducted in 2015 and focused on how motivational interviewing as opposed to no interviewing would help reduce obesity. There were 99 participants that were placed into 2 groups, 58 were placed in a control group, and 41 in a motivational interviewing group. The participants in the control group watched educational videos, and the participants in the motivational interviewing group attended a teens program, which focused on teaching, encouragement, exercise, and nutrition support, along with their parents. And the results showed that the participants that attended the teens group and the motivational interviewing group had an increased reduction in their body mass indexes than those that were in the control group. So the results of these research studies shows that through the combination of diet and exercise as opposed to no lifestyle change in the pediatric population, that there can be a reduction of obesity. They should be encouraged for parental participation, as participants will be more apt to be compliant with their parents involved, and there should be continuous patient progression monitoring performed by a healthcare professional that has been trained to ensure health is being maintained and to encourage the parents to keep accurate diet and exercise logs. So the proposal intervention for this patient population is to implement diet and exercise through a designated plan to improve patient pediatric obesity through monitoring patient progression in an outpatient rural health clinic setting by trained advanced healthcare providers. When there's appropriate patient monitoring and involvement, parents and the providers can assist in the reduction of pediatric obesity by encouraging the pediatric population to move more and eat healthier, and therefore reduce the high number of pediatric patients that are obese in today's world. If there are any questions that you have in relation to this topic and the results that were reported through the presentation, please feel comfortable to post them in the discussion board, and I will get to those as soon as I receive them. Try to get you the answer. If we don't know them, we will look them up. Thank you very much.